Unexplained infertility makes up nearly 30 to 40% of all fertility challenges. But here's the problem. When a woman hears that her struggles are unexplained, it can feel like hitting a dead end, confusing, frustrating, and it can feel really defeating. The reality, in most cases, it's not truly unexplained. It's simply that the right areas haven't been investigated deeply enough. There are answers, but they're often missed when testing stops too soon or it doesn't look at the full picture. One of the biggest reasons women get labeled with idiopathic infertility is because the right blood work was never ordered in the first place or optimal ranges were not discussed. And that's exactly what we're diving into today, the most commonly overlooked fertility labs. These are the tests that often get brushed aside, yet they can hold the answers that many women have been searching for. But what I've found time and time again is that normal doesn't always mean optimal. Just because something falls within a wide reference range doesn't mean it's working the way it should for fertility. And often it's only when we dig deeper, running the right labs, asking the right questions, and looking at the full picture that the real answers finally show up. By the end of this video, you'll know which overlooked labs can reveal the real reason you're not conceiving, how these labs connect to ovulation, egg quality, and implantation, and the exact stories of women who turned things around once these labs were uncovered. Take CM, for example. At age 25, she had already been trying to conceive for 3 years. Doctors told her that her fertility issues were unexplained. But her periods were agonizing. She had low iron, low vitamin D, and clear markers of inflammation. Yet none of these were ever addressed or brought up in her blood work. Once she had the guidance to ask for the right tests, they finally uncovered what was really going on. And we were able to give her the nutrients her body was missing and target the inflammation that had been holding her back. Slowly but surely, her body began to respond. Her hormones balanced, her cycles began to regulate, and for the first time in years, she actually felt hope. That shift, that moment when everything starts to align, is why looking deeper and supporting the body properly makes all the difference. And within just 4 months of working together, she had her first positive pregnancy test, and now she's in her second trimester. And we're still working together as she navigates the ups and downs of pregnancy, tackling common challenges like constipation, morning sickness, urinary tract infections, and other symptoms. The good news is that many of these can be supported through targeted nutrition, supplements, lifestyle adjustments, and medications when needed. So she feels empowered and supported every step of the way. And the moral of this story? It's exactly why I'm so passionate about advocating for the right labs. Because the truth is, the answers are often hidden in plain sight. They're not unexplained, they're just waiting to be uncovered. The right test can reveal nutrient gaps, hormonal imbalances, and hidden inflammation that are silently holding women back. When we identify and address these issues, it can completely change the trajectory, from frustration and heartbreak to hope and clarity, and results. That's why I fight so hard for every woman to get the investigations she deserves, because it can literally change everything. So let's dive into one of the most overlooked areas when it comes to fertility, and that is the metabolic labs. These tests give us a window into how your body is managing blood sugar, insulin, and hormones behind the scenes. Things that can have a huge impact on ovulation, egg quality, and overall fertility. The main players here are your lipid panel, Hemoglobin A1c, fasting insulin, fasting glucose, and C-peptide. Each one tells a unique story about how your body is functioning metabolically. For example, subtle changes in insulin or blood sugar might not show up in a routine checkup, but they can quietly disrupt hormones and fertility over time. Understanding these labs and their optimal ranges is often the missing link for women who've been told everything looks normal, when in reality, their bodies are sending important signals that need to be addressed. So let's talk about the lipid panel. Think of cholesterol as the backbone of your hormones. Estrogen, progesterone, testosterone, they all start with cholesterol. If cholesterol is too low, your body can struggle to make these hormones efficiently, which can impact both ovulation and cycle regularity. On the flip side, high triglycerides often indicate excess sugar, excess refined carbs, or excess processed foods or insulin resistance. And here's the key. Insulin resistance can throw off ovulation and make your cycles irregular. So the lipid panel isn't just about heart health. It's directly tied to your reproductive hormones. Next, let's talk about hemoglobin A1c, often short form to A1c. This is your average blood sugar over the past 3 months. And it gives us insight into how your body is managing glucose over time, not just a single moment like a fasting glucose test. And here's the science behind it. Hemoglobin A1c measures how much sugar sticks to your red blood cells, a process called glycation. Think of it like sugar coating your blood cells over their lifespan. Glycation happens when glucose irreversibly binds to hemoglobin in red blood cells. So the more sugar that's in your blood, the more glycation occurs. And because red blood cells live for about 3 months, the hemoglobin A1c gives us a snapshot of your average blood sugar over that time period. In more technical terms, calculating hemoglobin A1c involves a model that considers how long red blood cells live, how much glucose they take up, and the rate at which glycation happens. This tells us the total fraction of glycated hemoglobin in your blood, basically how sweetened your red blood cells are over time. So why does this even matter for fertility? If hemoglobin A1c is high, your eggs and uterine lining are being exposed to sugar-related stress, and this can reduce egg quality and make implantation more difficult. In other words, even if you feel fine, your eggs may be silently affected by blood sugar fluctuations. But blood sugar alone doesn't give you the whole story. And that's where fasting insulin comes in. It shows us how hard your body is working behind the scenes to manage that sugar. When we look at fasting insulin alongside fasting glucose, we can calculate something called HOMA-IR, a number that helps predict insulin resistance and reveals whether your body is keeping up or struggling. And why do we care so much about insulin resistance in the context of fertility? Because it can literally shut down ovulation. It also drives inflammation, making uterine lining less hospitable for an embryo to attach to. And that's why a woman can have normal cycles on paper, but still struggle to conceive. The metabolic signals underneath are telling a very different story. And then if we do have issues with blood sugar regulation, then to get an even clearer picture of what's going on behind the scenes, we'll often look at C-peptide. Think of it as a peek behind the curtain at how much insulin your pancreas is actually producing, giving us insight into whether your body is keeping up, overworking, or underproducing. So a high C-peptide means that your pancreas is overworking, and this is often what we see in type 2 diabetes. Whereas a low C-peptide level means your body isn't producing enough insulin, which is generally what we see with type 1 diabetes. And either imbalance can disrupt ovulation and hormone signaling. Essentially, it tells us whether your body's insulin system is supporting fertility or if it's silently getting in the way. And all these metabolic labs, the lipid panel, the hemoglobin A1c, fasting insulin, fasting glucose, and C-peptide, they work together to give us a full picture of your metabolic health. And metabolic health isn't just about numbers on a page. It directly affects ovulation, hormone balance, and the ability of your uterus to support a healthy pregnancy. So to see this in action, let me share the story of one of my clients who we will call KZ. At age 24, she was struggling with unexplained weight gain and growing frustrated over not conceiving. Her ovarian ultrasound looked normal, which left her feeling confused and a little hopeless. But together, we dug deeper. She got more thorough blood work done, and her labs revealed insulin resistance and elevated testosterone, key metabolic markers that explained why she wasn't ovulating frequently. To get these in-depth investigations, KZ was working with her fertility clinic, her medical doctor, and myself. Together, we focused on the foundations: nutrition, exercise, and targeted supplements to support her metabolic health and hormone health. And given her preferred timeline for pregnancy, we also discussed the benefits and considerations of using letrozole with timed intercourse through her fertility clinic. By combining this approach with blood sugar balance, lowering testosterone, and lifestyle support, we address the whole picture: hormones, metabolism, and ovulation, rather than just one piece of the puzzle. And the result? She conceived after just one round. So KZ's story is a perfect example of how medications and conventional fertility support can work hand in hand with metabolic and natural strategies to create real, lasting results. Next, let's talk about vitamin investigations. Your eggs or embryos rely on nutrient-rich blood to develop and thrive. Yet these basic markers are often overlooked for fertility testing. Without the right nutrients, even healthy eggs may struggle to mature properly, and implantation can be more difficult than it needs to be. If you're looking for a solid starting point for a comprehensive nutrient panel, ask your provider to check for ferritin to assess your iron stores, a complete blood count, also known as a CBC, and B12 and vitamin D. These simple tests can reveal hidden deficiencies that, when corrected, create a much stronger foundation for fertility and pregnancy. So, ferritin tells us how much body your iron has in reserve, but looking at ferritin alone often isn't enough. We also need to check inflammation markers like C-reactive protein and consider a complete blood cell count, so that's CBC. And why? So, ferritin is an acute phase protein. So it rises in response to inflammation, which can then hide a true iron deficiency. So if you have a lot of inflammation in the body, you could see high ferritin levels, when in reality, your iron is actually quite low. Maintaining ferritin at a healthy level before pregnancy is essential. Iron is needed not just for your own energy and hormone production, but also to support early fetal development. Low iron stores can increase the risk of fatigue, hair loss, miscarriage, and complications during pregnancy and birth. By identifying and correcting these deficiencies before conception, you give your body and your future baby the best possible start. And then the CBC gives us a comprehensive look at your blood health, covering everything from red blood cells to white blood cells. While red blood cells show us how well your body is transporting oxygen, white blood cells help us spot underlying infections or immune imbalances that may not cause obvious symptoms but can still trigger inflammation. This is especially important for fertility because chronic inflammation can make the uterine lining less receptive and create a hostile environment for implantation. Even if ovulation is occurring normally, subtle changes to the immune system or inflammation can prevent an embryo from successfully attaching and growing to the uterine lining. By identifying and addressing these factors early, we give the uterus the best chance to support implantation and a healthy pregnancy from the very start. When it comes to looking at red blood cell health, this helps us see if your body is efficiently transporting oxygen to your tissues, including the ovaries and the uterus, which is critical for egg quality, implantation, and overall fertility. By looking at the CBC alongside ferritin and inflammation markers, we can identify hidden issues that might otherwise be missed and address them before trying to conceive. And what's really cool about the CBC is that it can give us clues about both iron, folate, and vitamin B12 status. One of the key values we look at is the MCV, or the mean corpuscular volume, which tells us the average size of your red blood cells. A low MCV means that your red blood cells are smaller than normal. And this often points to iron deficiency because without enough iron, your body can't produce fully healthy, full-size red blood cells. On the other hand, a high MCV means your red blood cells are larger than normal, and this can indicate a deficiency in B12 or folate, both of which are crucial for proper red blood cell formation. But the aha moment comes when you realize that these nutrients are also critical for DNA synthesis and cell division, processes that directly impact egg quality and early embryo development. Folate, in particular, is vital for preventing neural tube defects in the developing baby, making it one of the most important nutrients to optimize before conception. So without enough B12 or folate, even perfectly timed ovulation and implantation might struggle to result in a healthy pregnancy. So by looking at MCV alongside hemoglobin levels, we get an even clearer picture of whether your blood can carry oxygen efficiently, which is critical for that ovarian and uterine health. So combined with ferritin and C-reactive protein, this helps us understand whether or not iron, B12, or folate are at optimal levels. Now, as previously mentioned, vitamin B12 plays a key role in fertility and overall health. It's crucial for egg quality and ovulation, and it can help with preventing miscarriage. Low B12 increases homocysteine, which is a compound that promotes oxidative stress and can damage eggs and the uterine lining, making implantation more difficult. And as mentioned earlier, B12 is also essential for DNA synthesis, red blood cell formation, and hormone production, all of which directly impact reproductive health. And because pregnancy dramatically increases B12 requirements, optimizing these levels before trying to conceive is critical. It sets the foundation for healthier eggs and a more receptive uterine environment, and just a smoother transition into pregnancy. And last but not least, we have vitamin D. Vitamin D isn't just about bone health. It's a hormone that plays a major role in fertility. It helps regulate reproductive hormones, supports ovarian function, and improves the environment of the uterus to make implantation more likely. It also helps to regulate inflammation as well. Low vitamin D is linked to conditions like PCOS, endometriosis, and reduced fertility. On the flip side, correcting a deficiency can significantly improve fertility outcomes, support hormone balance, and enhance the chances of a healthy pregnancy. Vitamin D works hand in hand with other nutrients like calcium and magnesium to support overall reproductive and metabolic health. And because so many women are deficient in vitamin D, it's one of the first labs I recommend checking and optimizing before conception to make a measurable difference. Now, we can't forget inflammation and thyroid health, two areas that are often completely overlooked when it comes to fertility blood work. CRP, also known as C-reactive protein, is a non-specific inflammatory marker. Think of it as a signal that your body is experiencing stress or immune activity somewhere. High CRP can affect your uterine lining, making it less hospitable for an embryo to implant. In many cases, addressing inflammation, whether through diet, lifestyle changes, or targeted nutrients, can be the difference between a failed cycle and a successful pregnancy. And when it comes to thyroid gland health, we often call it the master regulator of the body, and for good reason. The thyroid influences nearly every system, from metabolism and energy levels to hormone balance and menstrual cycles. For fertility specifically, a healthy thyroid helps regulate ovulation and can decrease the risk of miscarriage in some cases, which means that even subtle imbalances can quietly disrupt these processes, which is why looking at the full thyroid picture, hormones, and antibodies is so critical when trying to conceive. Now, I wouldn't say that every single person needs a full thyroid panel, but it becomes especially important in certain situations. For example, women with a history of miscarriages or a family history of Graves' disease or Hashimoto's thyroiditis are at a higher risk for thyroid-related fertility issues. It's also crucial for women with conditions like celiac disease or PCOS, since both can increase their likelihood of thyroid imbalances. In these cases, checking the full panel, including thyroid-stimulating hormone, T4, T3, and thyroid antibodies, can reveal hidden issues that might be quietly affecting ovulation and implantation. Catching these early gives you a better chance of supporting your body both before, during, and after pregnancy. And for those who have only had their TSH and T4 tested, it's important to know that a normal TSH doesn't always tell the whole story. Even if your thyroid numbers look normal, if antibodies weren't tested, their presence could quietly increase the risk of miscarriage. And also, the range of normal for the thyroid-stimulating hormone is quite large, and there is an optimal range. Now, today I won't be discussing optimal reference ranges because I'm located in Ontario, so my optimal reference range is different than those who live in the States or other parts of the world. Now, the good news regarding antibodies is that they don't have to stay elevated. With the right nutrition, targeted supplements like selenium and zinc, and strategies to reduce overall inflammation can actually help to lower antibody levels and improve fertility outcomes. Supporting your thyroid goes beyond lab numbers. It helps balance hormones, regulate ovulation, and create a uterine environment that's truly ready to sustain a healthy pregnancy. So here's the truth. Most women aren't struggling with fertility because it's unexplained or idiopathic. The real reason is often simpler. No one has ever run the right labs or looked beyond the standard normal ranges. Many labs have wide reference ranges that may technically classify a result as normal. That doesn't mean it's optimal for fertility. By digging deeper, checking the right markers, and understanding the ranges that matter for conception, we can uncover hidden issues that may be silently affecting ovulation, egg quality, and implantation. If you're ready to advocate for your fertility, I created a free PCOS Pregnancy Prep guide that walks you through which labs to ask about, how to track ovulation accurately, and the nutritional foundations that matter most. Grab it using the link below. It's completely free and will give you the clarity to take your next step. And feel free to tell me in the comments, which of these labs have you had tested and which are you realizing might be missing? And remember, your fertility doesn't have to be unexplained. It is waiting to be uncovered. I'll see you next time.